Hi everyone. Today I am talking about the topic skull. So uh, this is the this is our skull, and a skull is the structure of the head that protects the brain and support the face. These are our skull, and it protects the brain and supports the face. So it is divided into two parts: the cranium, this one is cranium, and the facial skeleton. These are our facial skeleton. And the cranium, it is the part of a skull bone from the cranial vault, and it is also known as skull vault, skull cap, and calvaria. These part is also known as calvaria or cranial vault. The facial skeleton, it supports the soft tissue of the face and determining the facial appearance. So these are our facial skeleton, and it support the face and determining our facial appearance. Now we are talking about here about the frontanels. It is very important topic. What is frontanels, and what are the roles, and what is the cranial sutures. सो अभी हम लोग जो है फ्रंटेनल्स के बारे में जानेंगे. तो फ्रंटेनल्स बेसिकली ये क्या होता है कि दिस इज membranous area that located in the cranial vault and that have not yet ossified. Means there are certain areas that are not ossified initially. And cranial sutures are strong, elastic, and fibrous joints that join the bones of the skull. So now we come over the part of cranial sutures or frontanels. So the frontanels, when we talk about the frontanels, there are basically 6 type of frontanels, and clinically significant and most significant frontanel are anterior brachmatic frontanels. This is most significant, and it visible clinically in a newborn baby. मतलब जब भी कोई न्यू बॉर्न बेबी होगा आप इसको देख सकते हैं. दिस इज एंटीरियर फ्रंटेनल, this area, and this is our posterior frontanel. And apart from that, posterior frontanel is lambda shape. When we talk about this is shape of the posterior frontanel is lambda shape, and shape of the anterior frontanel, it is diamond shape. So it is diamond shape. And now we start talking about the posterior frontanels. These are two anterior and posterior frontanels, and now we are talking rest of the frontanels. One is the sphenoidal and the other one is the mastoid. This frontanel is sphenoidal frontanel. यहाँ पे आप लोग देख सकते हैं कि ये जो है एरिया, this is sphenoidal frontanel, and it is paired right and left. So sphenoidal frontanel are two, and mastoid frontanel, mastoid you can see behind the ear. हम लोग यहाँ पे देख सकते हैं this area is mastoid frontanel, and it is also in pair. Okay. Now after talking about the frontanel, we also discuss about the clinical significance of these frontanels. Okay, so हम लोग यहाँ पे वन बाय वन करके देखेंगे कि क्या इसका significance है. So before going to detail, we are talking about just the significance of our frontanels. So when do frontanel and cranial sutures close? So first of all, the frontanel that is most significant frontanel is anterior frontanel, and this frontanel is closes age of 1 to 3 years of age. This frontanel is closes, and Apart from that, posterior frontanel, they closes about 2 to 3 months of age, and sphenoidal frontanel, they closes around 6 months of age, and mastoid frontanel, they closes 6 to 18 month of age. So these six are our frontanel, and a ossification occur if too early along these frontanels. What happened? Some children may suffer from premature fusion of sutures and frontanel, and that condition is known as craniosynostosis. Means बेसिकली हमारा जो ब्रेन है उसका ग्रोथ रेट क्या होता है, तो जो हमारा ब्रेन है उसका जो ग्रोथ रेट है एट बर्थ, जो ग्रोथ है वो 25% ओनली आवर ब्रेन इज़ डेवलप्ड, एंड आफ्टर 1 year ऑफ एज इट इज़ 50% डेवलप्ड, एंड up to 20 years of age our brain become fully developed. So these are the our ratio in different age of developing brain. So when we think about the frontanels, एक चीज़ है कि अगर फ्रंटेनल समय से पहले ऑसिफाई हो गया तो क्या हो गया, तो जैसे कि फ्रंटेनल्स है, द ग्रोथ पैटर्न ऑफ ए स्कल चेंजेज एंड इट मे रिजल्ट इन एबनॉर्मल शेप head and or developmental impairment that is visible. These are your frontanel. Here we already discussed anterior frontanel, and this is your posterior frontanel, and this is your squamous frontanel, this is your sphenoidal frontanel. In this picture you can see the skull of the neonates or newborn baby. Here from the top view of the skull हम लोग यहाँ पे देख सकते हैं कि this is our membranous connective tissue that is the part of anterior frontanel, and this anterior frontanel has membranous connective tissue so that it can compress during the birth. The large frontanels of human that allow the neonate's skull to compress at the time of delivery. We all know that there is anterior frontanel, and it is also known as brachmatic frontanel, and this frontanel is helpful in childbirth, because this frontanel compresses at the time of delivery, and thus part of adaptive solution to the problem of giving birth to large brain babies through a relatively narrow and rigid birth canal. सो ये बहुत ही इम्पॉर्टेंट थिंग है, बिकॉज if this large frontanels does not happen, and if it is not membranous, and if it is ossify, the childbirth via the birth canal is impossible, and due to the membranous nature of the frontanels during birth time, the neonatal skull become compressed and easily child birth through the birth canal. So it is very important because of their membranous nature of the frontanels.